Good afternoon. I'm happy to be here with Representative Cooper, and I'm going to give a little bit of background in preparation for her comments that will tell you about the real world. So we have been working with systems thinking and modeling with our legislature for a number of years. The Health Policy Center is a research center within the Andrew Young School of Policy Studies at Georgia State University. We do a lot of work in evidence-based research, program development, policy guidance. We work at the local level, the state level, and nationally. We're having our 20-year anniversary just now, and we have worked in over 800 communities across the United States in our various projects. One of the things that drew us into this work was the recognition that legislators are not just faced with routine technical problems, but they're facing issues that are hard to define, there aren't clear solutions, and there's no expert that can say exactly what to do. And our goal was to think about how to build some system thinking skills, how to help legislators think about the whole picture rather than the tip of the iceberg. When we started interviewing the legislators, we realized that legislators had different learning needs, and I could spend a whole talk on this particular slide, but the legislators actually categorized themselves in the course of the interviews into basic, I want to know the difference between Medicaid or Medicare, or I want to know what the letters stand for. Level 2, hot issues, I want to know about the topic that is on my mind right now. Level 3, if I could have a master's in health policy, that's what I want. I want all the knowledge I can get, and I want to be a leader in this area. And then level 4, the leaders who want to know enough not to make mistakes when they're in negotiations, and who also want to deal with special issues and have support in dealing with special issues. So this health policy certificate program was developed for those in level 3. And it's a program for lawmakers, and we use system dynamics and system thinking to encourage broader and more systemic approaches. More than 130 of our legislators and staff have attended the course, and almost 100 have met the attendance requirements to receive their certificate. And they get their certificate, as you can see in this picture, on the floor of the House and the Senate, and they really like that. This number of people who have attended is important because when we did our initial interviews, we were told that total across the Senate and the House and across years, there would be 10 to 30 legislators who would want this kind of support. And we were going to do it anyway if it was just 10 to 30, but it has turned out to be something that has been continued and is much more sought after than we thought, largely due, in some ways, almost single-handedly to Representative Cooper. So the program's set up. We've offered it now 4 times. We're getting ready to have our 5th cohort in just a few weeks. And they're core sessions about thinking systematically, about health status, about financing health care, about coverage and access. And then there is an application of those basic concepts to special topics that each cohort chooses for themselves. They always choose more on financing. They almost always choose a behavioral health topic. They usually choose something to do with obesity, and then there are various other topics that come up. So we have the health policy content, the systems thinking and conversation capacity, and the application. We've also done one advanced course, which which was requested when we had gotten enough of alumni who said, we want to come back, we'd like to have something more advanced. And we gave them more advanced content around financing, because that's what they always want to understand more about the money, and conversation capacity, and we added improvisational leadership into that part. This is something that you already saw, but we use this kind of thinking. And example, we, in the very beginning, created this 6-question framework. We put it on little cards. The legislators have it. We encourage them when someone brings a bill to them to ask these 6 questions. I mentioned earlier that the lobbyists have come to us and said, what again are those 6 questions? We want to know ahead of time so we can be prepared to answer the legislators' questions, which I consider to be a raising of the bar of the conversation. And so we use these system thinking, conversation, capacity building, just using the questions. We also, and this isn't intended for you to exactly see it, but the concept of behavior over time. It is amazing when you say to someone who's concerned about an issue, could you draw what is the behavior over time? What has been happening with that issue over the last 5 years or 10 years? And what happens when you do that is there's a realization that we really don't have the information, maybe not at all or not in our brains, about how things have been. So this is something that the legislators do routinely in our work with them. We also have done a lot of work with stock and flow diagrams. This is one, they're always made in the room with the legislators. This is one where they're looking at how do people get from at risk back to healthy and safe, and what does that involve. And these kinds of activities in the sessions with various topics result in ability to kind of see together something that they couldn't otherwise see. We also do some work with these where we bring in, where's the money and how does the money fit into this? One of the things that has resulted from using these is a much stronger appreciation for the importance of prevention. The pay me now or pay me later, and if you pay me later you're going to pay me more, is one of the phrases that the legislators coined in their work. And we do a model, and I'm going to say just a little bit more about that. In our first cohort, we wanted to build a model. We had some hesitation about using systems, like maybe it's going to be a little bit too geeky, but our group really appreciated it, and so we started working on building this model. And as Louise pointed out, we had a group of legislators and staff and experts who were the part of the group who were deciding what was going to go into the model, what are the assumptions that were going to be made, and we at the Health Policy Center served as Ross described, the translators. So this group worked together to develop the purpose and to look and test the model and to revise it until they were comfortable enough with it for it to be shared in a learning lab with others. They chose about 30 different policies that they were interested in looking at, and then they went through a process of narrowing the policy options. They were narrowed based on, would you even consider passing legislation? And like one of the things they said, we are not going to legislate what parents do in their homes with their kids. So take that out. We aren't going to do it. One of the legislators that was in on the work said, I want things to be in there that are worth me horse trading over. He was talking about, he didn't want just little, he wanted things of substance in there. We also had to consider what are the things that we have enough data to actually build the model. So it got narrowed down to these 6 interventions of safe routes to school, school food options, physical education, nutrition and physical activity, in preschool, after school, and then reimbursement for medical nutrition therapy. And so in the learning lab with someone who was a translator, the legislators had the opportunity to look at what's the base case and what might be the impact of various interventions, and to talk about that and rerun the model in the room and have discussion about it. And there's a lot to say about these learning labs and what happened with these, but was very positive and had a place, contribution to the legislature being able to pass legislation related to physical activity in schools that had been elusive in the past. And maybe Representative Cooper will say a word about that. We have a lot of system thinking projects at the Health Policy Center. We have the obesity model. We've also done for our Medicaid department a low birth weight model, and for a group, an injury prevention model. We've done a lot of different kinds of mapping, interdisciplinary collaboration within the university, dual eligible populations, sustainability and technical assistance. Rachel Forensic, who's here with me today, has worked a lot with the PRISM model with the community transformation grantees. We worked with all of Georgia's child-serving agencies on developing systems of care, maps, and strategies. We've been involved with Rethink Health, and we have used in Atlanta, as Bobby mentioned earlier today, the Rethink Health model in our Atlanta Regional Collaborative for Health Improvement. That's not my topic today. I'd love to have another chance to tell about that. But one of the things I will say on that is we went from not having a strategy at all to having a 28-year plan in one day in partnership with Bobby and using the Rethink Health model. And you know how some places spend years figuring out their strategy. We were ready to move into action after just, of course, a lot went into it, but also teenage pregnancy modeling and injury prevention. We've already covered some of the guiding principles that came out of an expert panel that we led at CDC. Bobby was on that panel, and these things have been pretty much covered, but these are the things that grew out of a number of people talking about their experience in trying to work with others with models. So I'm going to stop because I want you to have an opportunity to hear from Representative Cooper. It's an honor to have you here. I appreciate you traipsing up here with me to share.